Welcome to the Institute for Reproductive Medicine and Science at St. Barnabas. My name is Pat Rasinski, and I am the Clinical Nurse Manager for all IRMS offices. The video that you are about to view contains information that will help you as you proceed through your IRMS experience. Please remember that viewing it more than once or along with your partner at different stages of your treatment may prove valuable. We created this online orientation to provide our patients with the opportunity to learn about what to expect before, during, and once a medication cycle is completed. Most of the information we will review in this video you will also find in written form within your patient packet. You will also be able to access much of this information on our website, www.sbivf.com. Let's begin by reviewing the IRMS contact list which you have in your patient packet. The nurse or IVF coordinator that met with you at your initial visit will have highlighted your doctor's team. We believe that a team approach can make navigating through your fertility treatment a bit more helpful. Each physician at IRMS has key people on their team to work with you throughout your treatment. Each person on the team can assist you at any time. Please note that should any member of your team be out of the office for any reason, an alternate staff member will be assigned to assist you. By this time, you have had contact with our administrative coordinators. They assist patients with scheduling any office appointments or procedures done by our physicians, including any surgical procedures. They are also responsible for authorizing many of your diagnostic procedures. In our Livingston office, our IVF coordinators keep track of all of your prerequisite testing and checklist results. Anytime you need to know if a test result has been received and/or reviewed by your doctor, you should call your IVF coordinator. Your IVF coordinator will confirm with you that your checklist is completed and/or updated prior to starting any treatment cycle. Once your checklist is complete, your care will be transferred to the nurse on your physician's team. In the satellite offices, the nurse will handle both the checklist function and be your primary contact from your first visit. The financial coordinator is responsible for verifying your insurance benefits and reviewing this information with you. They are also responsible for obtaining prior authorization for your treatment before you can begin a cycle. You must be financially cleared by your financial coordinator before you can proceed with treatment. Your nurse, however, will be responsible for ordering and authorizing your medications. Your nurse is responsible to coordinate all aspects of your treatment cycle. She will discuss the timing of your cycle, review your medication protocol, order all necessary medications, and provide you with instructions throughout your treatment. For questions and information, your nurse is available through her phone number listed on the contact sheet as well as her email address. In addition to the nurse on your team, IRMS has a nurse on call for time-sensitive and emergency issues when the offices are closed. The nurse on call may be reached by calling the main number, 973-322-8286, after normal business hours. You will be asked to leave a message with our after-hours service, and the nurse on call will call you back. Familiarizing yourself with the people on your team is a great way to help ease anxiety you may have about your treatment. Also, becoming familiar with the office hours and monitoring hours at each of our locations at the outset of your treatment will help you to best manage your personal schedule. Another great source of information is our website, which includes an online message board. If you are seeking an online community, the message board may be a good place to see postings and comments from our physicians. Our own IRMS physicians cover the message board 7 days a week and will respond to anonymous postings. Please note, however, that once you are a patient at IRMS, you can speak to your physician directly at any time. The message board is not intended to replace contact with your physician. Now that you have a better understanding of our practice team approach and some of the important information, I would like to proceed to reviewing what to expect before a medication cycle begins. Prior to starting your cycle, there will be necessary prerequisite testing required for both patient and partner. We refer to this as your checklist. Some examples of the testing include, but are not limited to, blood work for both patients and partners, physical exams for patients, including vaginal cultures and pap smears, hysterosalpingograms, and semen analysis for male partners. Male patients also have a checklist that must be completed prior to treatment. There is a portion of this testing that we refer to as andrology testing and may include semen analysis and antisperm antibody testing. Hours for andrology appointments are also on our contact list. All prerequisite testing must be completed and results reviewed by your primary doctor prior to beginning any medication cycle. For Livingston patients, your IVF coordinator is your primary contact during this phase of the cycle. At all other IRMS locations, your nurse will guide you through the checklist process. Again, you must be advised that your checklist is complete and/or updated prior to the start of the cycle. Next, you will be instructed to contact your nurse to help coordinate your cycle. The nurse will review your medication protocol. Each physician will create a medication cycle plan based on a patient's age, history, and diagnosis. The nurse will then review this plan with you and provide you with a medication flow sheet. Our nurse, Wanda, will be reviewing the basics of the flow sheet later in this video. Once a flow sheet is given to you, the nurse will also review the medication ordering process. Infertility medications will sometimes need to be ordered through a pharmacy within your insurance plan or with a retail mail-order fertility specialty pharmacy. Your nurse will help guide you through this ordering process. All orders are sent to the pharmacy from our office. The pharmacy will then contact you as the patient to discuss your coverage, expected payment, and arrange delivery. As a special note for our IVF patients, your nurse will also need to review the timing of your cycle based on your medication protocol. Your individual protocol will determine the timing of your cycle. It is important for you to know that our embryology laboratory closes periodically throughout the year. This is taken into consideration when you work with your nurse in planning for your medicated cycle.
Welcome to your online orientation class. My name is Wanda Hofgesang, and I'm a registered nurse with the Institute for Reproductive Medicine and Science in the Livingston office. The online class has been designed to provide you with an overview of what to expect during your medication cycle. A brief reminder before we begin. You will need to make sure you have completed all prerequisite testing, which we refer to as your checklist, before you can begin. We also need you to have signed all appropriate cycle consents. Each cycle you do will need its own set of consents. The signatures on your consents must either be notarized, or you can return to the office and have the office nurse witness your signatures. It's also important that you follow up with your financial coordinator and make sure that you are financially cleared for your cycle. Some cycles require prior authorizations for procedures before you can begin. Each patient's physician will devise a medication protocol and treatment plan based on your age, diagnosis, and gynecological history. Your nurse will then review the medication ordering process. All medications will be ordered by your nurse via an insurance specialty pharmacy or a retail infertility pharmacy. Once an order has been placed on your behalf, the pharmacy will call you within 48 hours to review payment and shipment dates and where they are shipping it. If you do not hear from the pharmacy within 48 hours, please notify your nurse. Lastly, your nurse will provide you with a cycle calendar or a medication flow sheet. There will be some information already filled in, while other parts can be filled in by you as your cycle progresses. The flow sheet is a helpful guide, but please keep in mind your nurse will contact you during your cycle to review at all times what medications to take, the dosage, and when to take them. In addition to the class, you also can go on our website. Our web address is www.sbivf.com. This is our homepage, and you'll notice that we have an icon here that is for education. When you click on the medication information and video icon, it'll bring you to a screen here. On this screen, there's another little icon that will say, click here for injection training. It'll be helpful to review this part of the online video to see the medications and how to prepare them, mix them, and how to inject. Each of these medications is an injectable medication which has a corresponding manufacturer video which you are able to watch at any time. The videos will last anywhere from 3 to 4 minutes, and they're very helpful. They will also consist of in showing you injection technique as well. If I were to click on one of the medications, you will see the different steps outlined for you. There will be a narrator speaking to you about the different topics, and they will show you the different parts of the product and how to prepare it for administration and to inject and how to dispose properly of any sharps. And then off to the right, this is what the narrator will be speaking to you about. At any time, you can stop and pause the video and read the information to the right and then resume watching the video. This will be where you will need to go at any and all time that you have any questions about seeing the medication, what it looks like, how to mix, and how to inject. But do keep in mind that we are always going to also review this information with you when we call you during your cycle to help you know what your dosages are, and we will also assist you with where your medications are to be injected. Your nurse will provide you with a cycle medication flow sheet that's going to look like something like this. This is for a cycle where you'll be doing ovulation induction with artificial insemination. What you'll see on your flow sheet is that you'll have 2 phases listed. There will be a follicular phase and a luteal phase. The entire cycle calendar represents approximately 1 month's time. It will take you approximately 1 month from start to finish to complete your cycle. When your nurse has ordered your medications and you have received them, to begin your ovulation induction cycle, you would be asked by your nurse to call with day 1 of a full flow menses. Spotting does not count as a day 1. If your day 1 happens Monday through Friday, you're to contact your primary nurse between the hours of 8:30 and 4:30 p.m. If you get a period over a weekend, Saturday or Sunday, or after the hour 4:30, give a call to our main number at 973-322-8286, and you will be answered by the on-call nurse, and she can give you your next set of instructions. When you do call her with day 1, she will tell you to come in on cycle day 3, the 3rd day of your period. On cycle day 3, we are going to perform a vaginal ultrasound and a hormonal blood test. Between cycle days 3 and 13, you will be monitored by our office with vaginal ultrasounds and blood work. So between day 3 and 13, you'll come into the office frequently, often between around 5 to 7 mornings. These blood tests and ultrasounds do not require an appointment. However, your nurse will have had to have instructed you on which day to come in. It's always done early because we do need same-day results. Once your nurse calls you and tells you to come in for the early morning blood test and ultrasound on day 3, you will typically receive a call back from your nurse by 5 p.m. with medication instructions and results. That will be how you will know what medications you're taking and when and where to inject the medications. Medications will begin the evening of day 3. The first medications you will take are called Gonadotropins, which are stimulation medications. They contain either the hormone FSH or LH. Some examples of these medications are Gonalef, Follistim, Menopur, Repronex, and Brevel. These stimulation medications will allow for your ovaries to produce more than 1 egg. Our goal is to aim for 1 to 3, no more than 4 eggs with this type of cycle. If your body produces more than 4 eggs, your physician will discuss the possibility of canceling your cycle and starting again with a new cycle at a much lower dosage. We do this in order to not increase your risk of high-order multiple pregnancy. Therefore, it will be best to cancel, regroup, and try again. You will take these medications for approximately 7 to 10 evenings. We will always guide you with when and how much to take. You will get to determine the following. If you are comfortable, these medications could be self-injected or someone could give you the injection. They are tiny needles which are injected just beneath the skin in the fat layer. Think of a diabetic who may take insulin injections. These are the same type of shots. You will also be able to decide a time that will work best for you in the evening. We can suggest any time between 5 to 10 p.m. The injections are typically recommended to be given in either the lower belly or the upper thigh areas. You can also move the injections around if you would like to use just the thighs or just the belly. It's up to you, or you can use a combination of areas. Typically, these medications will feel like a little pinch, like when you get blood drawn, but you will not have any, or should not have any redness, swelling, or pain after the injection. You may not even realize you gave an injection the following day. Sometimes when the medication goes into the skin layer, it may cause a little bit of burning. That's okay, as long as that burning will subside. If you have any additional problems, you can call us in the evening. On-call nurse is on call from 4:30 till 11 p.m. at our main number of the practice. You will be able to refer to our online website to see the injections and the injection technique at any time. Remember to visit the medication videos. Once you're finished with the gonadotropins, you will then be able to stop the gonadotropin, and between cycle day 10 through 13 on your flow sheet, you will take a medication called HCG, which is human chorionic gonadotropin, and its trade name is Ovidrel. This medication helps our bodies induce an ovulation, releasing the eggs and preparing them for their final maturation step before you proceed with your artificial insemination. Keep in mind that you can feel the following symptoms when you're on these medications. It's common to feel a little pelvic bloating and a little bit of mild to moderate cramping. You are able to take Tylenol, extra strength Tylenol, or you can also hydrate well, and that can help with a little bit of the bloating. It is not recommended during these cycles to take Advil, Motrin, or Aleve, as these products are not recommended during pregnancy, and our hope is that you will be pregnant at the end of your cycle, so we do not want you to take those medications either. But you can take something for the cramping if you need to. If you ever get any extreme abdominal bloating, pelvic pain, nauseousness, and/or vomiting, we would ask that you call our office, and your doctor may recommend we bring you in for additional blood testing and ultrasound. When you take the Ovidrel shot between cycle days 10 through 13, you have now completed your follicular phase on your flow sheet. The following day after your Ovidrel injection, you will then be moving down on your calendar to what we call your luteal phase. Cycle day 1 on the calendar under the luteal phase will be where you'll put your day after the Ovidrel injection. When you fill out the calendar under the luteal phase with your dates, this will allow you to see the next steps that are to take place. Cycle day 1 and 2 of the luteal phase represents where you will have intrauterine insemination scheduled. Typically for a couple where there is a male partner producing a sample, we will perform one-timed intrauterine insemination on cycle day 2. Your partner and you will be asked to come in the morning of cycle day 2 for an early morning collection and then the insemination to follow. We do a procedure called a sperm wash in our laboratory where we remove the impurities from the seminal fluid and isolate just the sperm cells. That is the portion of the sample that gets injected into the uterus. This procedure takes approximately 45 minutes to perform in the laboratory. If any patient or a single female is doing this type of cycle and might be requiring donor sperm, you will have been guided with ordering the donor sperm in advance. We will have it in our laboratory, and we will also need to perform a sperm wash on that sample. For patients or partners who are using donor sperm, we typically perform 2 intrauterine inseminations, one on cycle day 1 and one on cycle day 2 of the luteal phase. We want to maximize the opportunity of pregnancy, so when using donor sperm, it helps to do 2 back-to-back inseminations. For these procedures, your nurse will guide you with scheduling them in the early morning hours, and usually the sperm wash will take about 45 minutes to no more than an hour to perform, and then the insemination will be to follow. For ladies to understand who are undergoing artificial insemination, you do not need to take that day off from work. Treat it as though you were going to your GYN for a pap smear or a vaginal culture. You will be placed in an exam room. The doctor will place in a speculum and pass a very fine catheter through the cervix into the uterus. This might create a little small cramp, and you might have a little spotting following the insemination. When you leave our office, you can resume your normal activities. Should you develop any abdominal pain or bleeding or a fever of greater than 100.4, please feel free to contact your nurse, and we will advise you of your next steps. Once you've had your artificial insemination, several days later, on day 5 of your luteal phase, we will bring you in for a blood test in the early morning to test your level of progesterone. Progesterone is a hormone that we secrete after we ovulate, and it helps to build up our lining, preparing it for hopeful pregnancy. We want to determine that your level is greater than or equal to the number 10. If it is, you will not need any supplementation, and you will await till day 16 to come to our office for an early morning blood pregnancy test. If you do get a period on or before day 16, you will be advised by your nurse to call her with day 1, and you may then start your cycle all over again. Sometimes it takes more than one cycle before you will see a positive pregnancy test. On average, it can take anywhere from up to 3 to 4 cycles before you might become pregnant. Don't lose hope. Just understand that it may take a different cycle, a new batch of eggs, before you'll see that pregnancy result. If your progesterone level on day 5 happens to fall below the number 10, your physician may recommend progesterone supplementation. Typically, we supplement progesterone levels with either a vaginal suppository or an oral tablet. Your physician will determine which form of progesterone you will need, and your nurse will call in the prescription locally to a local pharmacy and give you instructions. When taking progesterone supplements, they work very well, but they may prevent you from bleeding, and therefore you may not know whether or not you're actually pregnant. So for our progesterone patients, we will advise you to come in on day 16 for a blood pregnancy test in the early morning hours. If that pregnancy test reveals that you are not pregnant, we will need to stop your progesterone supplement and you will get a period several days later. On day 16, we will measure your blood work for a positive pregnancy. If we detect a positive pregnancy level in your blood work, we will then begin monitoring your pregnancy with weekly blood testing and ultrasounds for approximately 1 month. You will come into the office early. You'll be able to go to any office, and we will review the hours to go to that office for your monitoring. Your doctor's looking to see that the pregnancy is developing in the appropriate place within your uterus. We want to determine if there's any multiple pregnancy, and at approximately 6 weeks pregnant, we will determine a heartbeat. Once a heartbeat is detected, we will then have you ask for your records, a records request, so that we may send your records to the OBGYN that will be following up with your pregnancy care. At 6 weeks with us, we will also recommend that you make your OBGYN appointment for approximately 3 to 4 weeks from your heartbeat. This way, when you are discharged with our practice at 8 weeks, you will have an OBGYN appointment and all of your records can be there at the office. This orientation class is part of your checklist. Now that you have completed this orientation class, please email your nurse and IVF coordinator with the number that appears at the bottom of this screen. This will indicate that you have watched the video and can be noted on your checklist. The next step is to review with your nurse your cycle medications and view the appropriate medication instruction videos via the Freedom Med Teach link.